Hello everyone, I am Dr. Shankar Dey and today's topic is carotid body tumor. So first of all, you have to know what is carotid body tumor. Carotid body tumor is one type of tumor that arises from carotid body. So what are the synonyms for this tumor? So first of all, what are the synonyms for this tumor, carotid tumor? So carotid tumor is also known as potato tumor. So potato tumor, carotid body tumor is also known as potato tumor or also known as chemodectoma. Chemodectoma. As carotid body is chemoreceptor, the tumor arising from chemoreceptor is known as chemodectoma, and it is also known as non-chromaffin paraganglioma. So non-chromaffin paraganglioma. So carotid body tumor is also known as potato tumor or chemodectoma or non-chromaffin paraganglioma. So first of all, you have to know what is carotid body. So what is carotid body? This is carotid body. See in this image. See in this image. This is carotid body. This is actually carotid body. Carotid body, normal carotid body is 3 to 5 centimeter in size, 15 milligram in weight, 15 milligram in weight, and flat brownish nodule in the adventitious of common carotid artery. It consists of chip cells that contains catecholamine granules and supportive cell. So normal carotid body is nothing but a flat brownish nodule that is present in adventitious of common carotid artery, consists of chip cell which contains catecholamine granules and supportive cell. It is supplied by herring nerve. It is supplied by herring nerve, that is a branch of glossopharyngeal nerve. This actually acts as, this carotid body act as chemoreceptor that are sensitive to changes in pH and temperature of the body in case of hypoxia, and helps in autoregulation or chemoregulation of respiration and circulation. So this is about normal carotid body. So when it is carotid body tumor, it is a tumor mass that is arising from this body, this carotid body, which is located at the bifurcation of common carotid artery. So that is carotid body tumor. So now we'll learn what is carotid body tumor, what is the origin. So what is carotid body tumor? Carotid body tumor. So carotid body tumor is nothing but a tumor mass. A carotid body tumor is tumor mass that arises from this carotid body. Arises from this carotid body at the bifurcation of common carotid artery. By sorry bifurcation of common carotid artery. As you can see, this is common carotid artery and this is the bifurcation of common carotid artery. This is external carotid artery and this is internal carotid artery. So at the bifurcation from this body, the tumor is arising. That is why it is known as carotid body tumor, also known as potato tumor or chemodectoma or non-chromaffin paraganglioma. So what is the origin? The origin of the tumor is carotid body located at the adventitia of common carotid artery near its bifurcation. So origin is from adventitia of common carotid artery near its bifurcation. So this is origin. So carotid, normal carotid is derived from neural crest, which is essential for adaptation in fluctuation in the oxygen, carbon dioxide and pH level. And this carotid tumor can be sporadic. Mostly it is sporadic in nature. In 75% cases, it can be familial. So carotid body tumor also can be familial. In case of 20% cases, familial cases is common in young individual and can be multiple, and hyperplastic in 5% cases, which is associated with chronic hypoxia. Chronic hypoxia in people living in high altitude, 5,000 feet from sea level, COPD, cyanotic heart disease. So hyperplastic type of carotid body tumor is common in chronic hypoxic cases, like people living in high altitude, 5,000 feet above from the sea level, or COPD patient or cyanotic heart disease patient. These tumor are either benign, so the nature of the tumor is either benign or locally malignant. So this tumor can be either benign or locally malignant. In 10% cases, it is locally malignant, but mostly it is benign. But in 20% cases, it can spread to adjacent lymph node, spreads to regional lymph node or lung, regional lymph node or lung in 20% cases. In 20% cases, so it, most of the cases, either it is benign or locally malignant, but in 20% cases it can spread to regional lymph nodes or lung. What is the blood supply of this tumor? Blood supply. So the blood supply, source of blood for this tumor is external carotid artery. External carotid artery, ascending pharyngeal branch of external carotid artery. The tumor does not secrete epinephrine or any endocrine substances. Blood supply comes through Meyer's ligament on the posteromedial wall of carotid at bifurcation. Now we will discuss the pathology of this tumor. So what is the pathology of this tumor? So pathologically it is well encapsulated tumor. So it is well encapsulated tumor. It is not hormonally active, not hormonally active, doesn't secrete any type of hormone like epinephrine or any, sorry, just 1 minute, sorry. It is not hormonally active, not, the tumor is not hormonally active, doesn't secrete epinephrine or any other endocrine substance. It is hard in consistency, hard in consistency, creamy yellowish in color. So the tumor is creamy yellowish in color, creamy yellowish in color with dense fibrous tissue. So dense fibrous tissue present in carotid body tumor, dense fibrous tissue present in carotid body tumor. So it is well encapsulated, not hormonally active, hard, creamy yellowish tumor with dense fibrous tissue. Now, what is the histological features? So what is the histological features of carotid body tumor? So histologically you will see cells arranged in, cells arranged in classical pseudo-alveolar pattern. Classical pseudo-alveolar pattern, also known as gel balloon pattern, also known as gel balloon pattern. It contains type 1 chief cells with catecholamine granules and type 2 sustentacular cells. So type 1 cells or chief cells, it contains chief cells with catecholamine granules, and type 2 cells or sustentacular cell. Sustentacular cells. Now, what are the clinical features of this tumor? Now, we will discuss the clinical features of carotid body tumor. Clinical features, it is usually unilateral. So, first of all, it is usually unilateral, and in 5% cases, it is bilateral. Maximum cases, it is unilateral. In 5% cases, it is bilateral. It is common in middle age group people. So middle age group people is most commonly affected. Then it is common in females more than males. Then the swelling in this carotid region is smooth. Swelling in the carotid region is smooth, firm, and pulsatile. Pulsatile in nature, transmitted pulsation is seen due to pulsatile carotid vessels overlying its surface, and it moves, the tumor moves only side to side but not in vertical direction, only moves side to side but not in vertical direction movement is not possible. It is called Fontaine sign. It is called Fontaine sign. The tumor moves only in side to side direction, not in vertical direction. It is called Fontaine sign. Then, what are the clinical features? The clinical features may be like, headache, then neck pain, dysphagia, or syncope. This may be the clinical features or presentation of this tumor. In 10% cases, it may present with cranial nerve palsy like hypoglossal, glossopharyngeal, or recurrent laryngeal or spinal accessory nerve palsy. Sometimes it may also present with sympathetic chain palsy. So, can present with also Horner syndrome due to sympathetic chain palsy. Cranial palsy, like in case of hypoglossal nerve, deviation of the tongue; in case of glossopharyngeal nerve, dysphagia; or due to recurrent laryngeal nerve palsy, unilateral vocal cord palsy, hoarseness of voice; because of spinal accessory palsy, drooping of shoulder, etc. Sometimes transient ischemic attack TIA may be seen due to compression of carotid artery. This is also called carotid body syncope. This is also called carotid body syncope. Syncope because of transient ischemic attack occurring secondary to carotid body tumor. This is also called as carotid body syncope. On palpation, thrill may be felt, and on auscultation of this tumor with stethoscope, bruit may be heard. It is located at the level of hyoid bone. So, at the level of hyoid bone, deep to anterior edge of sternocleidomastoid muscle in the anterior triangle. It is vertically placed, and it is firm potato-like swelling. That is why it is also known as potato tumor. Often, this tumor may extend to the cranial cavity. Sometimes this tumor may extend to cranial cavity, then it is called dumbbell tumor. When it extends to the cranial cavity, then it is called dumbbell tumor. Dumbbell tumor. Now I will show you the image of carotid body tumor. So see, this is the image of carotid body tumor. Here you can see The presence of carotid body tumor at the level of the hyoid bone is smooth, firm swelling arising from carotid body at the level of the hyoid bone in the anterior edge of the sternocleidomastoid muscle in anterior triangle. It is vertically placed, round and smooth. On palpation, thrill may be felt, and on auscultation, bruit may be heard. So this is about carotid body tumor clinical features. I have discussed the site at the level of the hyoid bone deep to anterior edge of sternocleidomastoid in anterior triangle, and extension, it may extend into the cranial cavity along the internal carotid artery, then it is called dumbbell tumor. Now I will discuss the classification of this tumor. So classification of this tumor. The classification criteria is Chamberlain classification. So the classification criteria is Chamberlain classification of carotid body tumor. Classification of carotid body tumor. According to Chamberlain classification, carotid body tumor is of three types. So this is Chamberlain classification of carotid body tumor. First one is type 1. So first one is type 1 tumor. So as you can see, this is type 1 tumor, this is type 2 tumor, and this is type 3 carotid body tumor. Type 1 carotid body tumor is localized and easily resectable, and it is not adherent. So localized, easily resectable, as you can see, it is not adherent to either internal carotid and external carotid. This is a cross section showing it is not adherent to internal or external carotid. It is localized and easily resectable. It is seen in 26% cases. In type 2, it is adherent. It is adherent to either internal or external carotid artery. It is partially surrounding the carotid. So it is partially surrounding the carotid arteries. So partially surrounding the carotid. It is the most common type of carotid body tumor, type 2, seen in 46% cases. As you can see, it is partially surrounding the common carotid and external internal carotid arteries. It is adherent. And see the type 3, it is completely encase the carotid. So it is adherent and not partially, it is fully, it is completely encasing the carotids. So this is type 3 tumor, completely encasing the carotid arteries. It is seen in 27% cases. So type 1 is localized, easily resectable. Type 2 is partially surrounding the carotid arteries, and type 3 is completely surrounding the carotid arteries. Type 1 is easily resectable, not adherent. Type 2 and 3 is adherent. Next thing is investigation that has to be performed in case of carotid body tumor. So investigations. So what are the investigation that has to perform to diagnose this tumor? First of all, Doppler study. So first thing you have to done is Doppler study, carotid artery Doppler study. Second thing that you will perform, that is angiogram. And what will be the finding on angiogram? I will show you image of angiogram. So this is actually angiogram. This is actually angiogram picture. Here, as you can see, angiogram is showing tumor blush. You can see the tumor blush sign in this region. The tumor is arising in between internal and external carotid artery. Tumor is showing tumor blush sign, and there is widening of this carotid artery, internal and external carotid artery. Normally after bifurcation the carotid artery are like this, but here because of origin of this tumor, the carotid artery internal external carotid artery is widened because of presence of tumor in between the external internal carotid artery widen, or space between external internal carotid widen. This is called splaying sign. This is also known as Liar sign. See, this instrument is actually Liar, as because of widening of internal external carotid artery, it looks like Liar. See, it looks like Liar. This is external, this is internal carotid artery. This looks like Liar, this instrument. That is why it is known as Liar sign. So this is Liar sign. So tumor blush with this widening of internal and external carotid artery, Liar sign. So what are the findings on angiogram study? One is tumor blush sign. So tumor blush. Another is Liar sign, or widening or splaying of internal external carotid artery due to presence of tumor in between. Next thing that has to be performed, that is CT scan of head neck region to see the extension, then MRI magnetic resonance imaging, then MR angiography, MR angiography, and sometimes MIBG scan is useful. MIBG scan in multiple familial and functioning tumors. For multiple familial and functioning tumors, MIBG scan is useful. So what are the tests that you will not perform in case of carotid artery? That is important. As it is vascular tumor, you will not perform any type of FNAC, fine needle aspiration cytology, or any type of biopsy like true cut biopsy, or any excision, partial excision of the tumor. So these are the procedure that are contraindicated. So FNAC is contraindicated, true cut biopsy is contraindicated, and partial excision of the tumor is contraindicated. Now, what are the DD, or differential diagnosis of the tumor? So swelling in this region maybe carotid body tumor, the tumor we are discussing, or carotid artery aneurysm, carotid artery aneurysm, carotid artery aneurysm, or maybe enlarged lymph node of anterior triangle like level 2 or level 3 lymph node, or neurofibroma of vagus nerve, or neurofibroma of vagus nerve present as a swelling in carotid triangle, neurofibroma of vagus nerve. In case of neurofibroma of vagus nerve, on palpation of the swelling, the patient develops bradycardia and dry cough, and it doesn't move with deglutition and has only transverse mobility. As the tumor lies behind the carotid, it can stress the carotid in front and causing transmitted pulsation also. So these are the differential diagnosis of carotid body tumor. In case of this carotid artery aneurysm, the aneurysm is seen like this in the arterial end. So this is actually carotid artery aneurysm, dilatation of carotid artery itself. But in case of carotid body tumor, the tumor is originating from the carotid body in this region in between internal and external carotid artery. Lastly, now we will discuss the treatment of this carotid body tumor. So what is the treatment? In case of small tumor, if it is small, then it can be excised completely. So in case of small tumor, the tumor can be excised completely, as the tumor is situated in the adventitia, or outermost layer of the common carotid artery. And if the tumor is large, then complete excision to be done with vascular graft. So if the tumor is large, then you have to excise the tumor completely with vascular grafting. And one important procedure, that is temporary shunt, is important during the operation. What is this temporary shunt during operation? During resection, a temporary shunt is placed in between common carotid artery and internal carotid. Suppose this is the artery, this is common carotid artery, this is internal carotid artery, and this is external carotid artery. So during resection, a temporary shunt is placed between these two artery, means common carotid artery below and internal carotid above, to safeguard the cerebral perfusion, and external carotid artery is actually ligated, so that the perfusion of the brain is not hampered. So this venous or prosthetic graft is placed between common carotid and internal carotid during surgery to safeguard the cerebral perfusion, to prevent any damaging effect of reduced circulation in the brain. So this is temporary shunting used during operation. And the carotid body tumor is not radiosensitive. So this tumor is not radiosensitive. So radiotherapy is not useful in case of this tumor, carotid body tumor. So what are the complications of surgery? Lastly, complications of this surgery. So what are the complications of surgery? One, there can be profuse bleeding during surgery at the tumor arising from the adventitia of the large vessels. There can be profuse bleeding, there can be blockage of carotid arteries. So there can be blockage of common carotid artery leading to contralateral hemiplegia, because of blocking of common carotid artery, and this hemiplegia is actually prevented by this temporary stenting between common carotid and internal carotid artery is done during surgical excision of the tumor. And what are the other complication of surgery? There can be cranial nerve damage or injury, like injury to vagus nerve or injury to spinal accessory nerve. Injury to vagus nerve can cause, or recurrent laryngeal nerve can cause, vocal cord palsy and hoarseness of voice. Injury to superior laryngeal nerve can alter the pitch of the voice, and injury to spinal accessory nerve can cause drooping of shoulder. So this is all about the carotid body tumor. Carotid body tumor introduction, clinical features, investigations, differential diagnosis, Shamblin classification, treatment, and complication of treatment. So for such type of clinical lectures, don't forget to subscribe the channel Dr. Shankar Dey. So subscribe the channel Dr. Shankar Dey for more videos on surgery or other subjects of MBBS curriculum. Stay tuned for the next video. Thank you for watching.